Growth in any region is expected, and that includes here in Simcoe County. The population will reach 1.3 million people by 2051, so the need to expand is crucial. Joining us now to talk about the future of the Royal Victoria Regional Health Centre is its president, Gail Hunt. It's nice to see you again. It's been far too long.
Yes, nice to see you as well, Sarah. Thanks for having me.
Thank you very much. It's going to be a very busy year ahead. Let's talk about the expansion and the Barrie campus. Where will it be most notable?
Yes, expansion work is underway constantly. I think it feels like internally it's all we talk about, but so in the Barrie campus, what people can expect to see over time is that expanding regional programs, starting out with our ICU, moving on to the NICU, the neonatal intensive care unit, adding more diagnostic equipment, and of course, eventually expanding our cancer center as well, emerge department, adding some beds, that sort of thing, really supporting all those regional programs that we do.
Do we have a rough timeline for that?
No, we would love to start tomorrow breaking ground, but the ministry process is a 9-step process, and we're at step number between 2 and 3, sort of straddling right there. So as we move through that, we're hoping to, like in 2 years, we're going to start some of the projects, actual construction. So hopefully within the next 2 years, we'll be starting the ICU work because that's deeper in planning, and then moving on to the NICU.
What about the Innisfil campus?
Innisfil, yes. Innisfil, we're really excited about that. It'll be a lot simpler project given it's a greenfield and not a disruption to services. So first step is actually we are opening our 3rd MRI in Innisfil at the Rizzardo Center. And then of course when we move on to our Innisfil campus, that will be starting out with outpatient services. So we'll have an urgent care center that patients can access, and then we'll be attaching other outpatient clinics. So we'll have lots of ambulatory space for patients to be able to see doctor visits there, special clinic visits, diagnostic procedures, and of course an urgent care center to get those visits like you would like an emergency department, not quite that level of acuity.
And then within those spaces, let's talk technology. There's been great focus on the addition of the 2 robots to the team. Anything else that you can share with us that's on the way?
Yes, well, the campus in Barrie is about 12 years old now, 12 to 13 years old. So that's about the lifespan. 10 years is usually the lifespan for a lot of diagnostic equipment. So we've actually have 2 MRIs at RVH. We finished replacing one last year, and we're underway replacing the second one. That should be done this spring. So we'll have 2 brand new MRIs, which means faster, clearer images. Then after that, we'll probably start on our CT scanners. After that, there's always something every year. And then, of course, like I mentioned, the 3rd MRI added to the Innisfil campus. And we're also looking at adding a 5th linear accelerator to the hospital. We're advocating for that right now for our cancer center. We have very high volumes for radiation treatment in this region, and we actually have the least amount of radiation machines compared to other cancer centers that are less busy than us.
Another area that we've talked about that sees quite a high volume is the ED. Yeah. So you've introduced the pink zone, the cold and flu clinic. Has that helped ease up the numbers and the wait times for people?
Yes, yes. If you're able to, what we have online is a triage, you self-triage, so you're able to go on and it screens based on your symptoms. And if you meet the criteria, you can book an arrival time, which is a lot easier when you're, especially with small children, or you need to go to the emerge, but you don't need to go immediately. It's not that level of urgency. So you're able to schedule an arrival time. And most of the patients are in and out within 90 minutes, which if you have small children is a very pleasant visit if you can be in and out in 90 minutes. And as well, we partnered with the Barrie Area Ontario Health Team, and we've opened a cold and flu clinic at the same area on the weekends, so people can come in and access that as well. So it is helping, when you go to the emerge, serious things can stay in the regular emerge department, but if you have a minor ailment, infection, you can fast track through on our pink zone.
Holy smokes, you've got a lot going on.
We do.
Let's pull up the website because this is obviously an ongoing process and we are doing our best to keep all of the details in one place where you can find it, ctvnews.ca/Barrie.